Hi everybody, my name is Dr. Shah Mohammed and I'm an assistant professor in the teaching stream at the Lawrence S. Bloomberg Faculty of Nursing at the University of Toronto. I'm also an academic fellow at the Center for Critical Qualitative Research, also at the University of Toronto. So my own research interests include palliative care and end-of-life care, nursing ethics and critical qualitative research, and also cancer research. So today I'm going to talk to you about case study research, which is a really interesting and exciting way to do qualitative research. Before I begin, I'd like to talk a bit about cases. So cases have been a part of how we think in the health sciences and in medicine for many years. For example, one of the most famous psychiatric cases was Dora by Sigmund Freud, which was a single patient case where he developed ideas about hysteria and psychoanalysis. Freud later applied knowledge gained in the case of Dora to similar patients with similar diagnoses. Examining cases is also part of how students in the health sciences learn about clinical practice. I'm sure people have had experiences where the professor gave a lecture and then provided a case about pneumonia or sepsis to illustrate the material in more depth. Even clinical rounds at a hospital are about how a healthcare team might discuss a difficult patient case. Case study is used in the health sciences, but also in political science, geography, and the social sciences. In the health sciences, cases have been used to examine diabetes, cardiac care, and healthcare leadership. Case study has also been used in quantitative and mixed method literature, but today I'm going to talk about qualitative case study research. So we already know about cases, but today I want to introduce the unique ways I use the method in my own research. For example, in my most recent case study, I collected case studies of how patients with advanced cancer sought biomedical treatment like clinical trials. And I'll speak more about this study as an example of how researchers like myself might assemble a case in their work. To highlight my discussion, I'm going to focus on three main themes. So some of the benefits of critical qualitative case studies is that it encourages researchers to select or focus on a bounded or narrow topic. It allows for diverse types of information to be collected by the researcher, and also provides a way for researchers to think about different viewpoints about a particular topic. So to conclude the talk, I'll make recommendations for the next steps for people who are interested in conducting qualitative case study or using it in their own academic or clinical work. So case study is considered to be an older form, traditional form of qualitative research. However, case study, I feel, still has relevance for research today. In general, case study focuses on how and why questions in research. For instance, why is something happening repeatedly in clinical practice? How is it that this event keeps on happening? Case study also develops in-depth and real-life contextual information about a topic. So the ability of case studies helps researchers to delve deeper into a clinical problem, understand its contexts, which is a form of strength about this method. Also, if researchers are strategic in how they assemble the cases, the type of research can provide knowledge about a topic beyond the actual case being examined that can be transferred to other situations. So I want to talk to you about bounding and how to bound a case. So one of the important questions that I often ask in my work is, what is this a case of? And I wanted to talk about some of the strategies for bounding a case. And this might include focusing or narrowing the case, which is a very important part of case study research. So usually I focus the case to fit the very specific objectives about a study. Another consideration is whether I want to collect typical or atypical cases, or perhaps a combination of the two cases. So a typical or representative case is a case that often doesn't deviate from the norm, or what commonly occurs in a particular situation. An atypical case, which is sometimes called a radical or outlier case, examines an unusual phenomenon that often doesn't happen in everyday life or clinical practice. So since they involve mechanisms or processes that may be unusual, examining atypical cases often provides more information than a typical or representative case. So the unique information provided by an atypical case might be of interest to students, researchers, and also clinicians. So I wanted to provide a very short example of how I narrowed the focus of my cases in a research project about cancer. So I knew I was interested in treatment choices in cancer. However, the topic of treatment choices seemed too broad to collect cases on. So I narrowed my topic to choices at the end of life. But this also seemed a bit too broad to collect cases on. So for instance, there may be several choices at the end of life, the choice to do advanced care planning, or maybe the choice to die at home. So I decided to narrow the cases to oncology treatment choices in advanced cancer. So I felt that this was a more focused on a type of treatment. So for instance, the choice to treat cancer with chemotherapy or radiation therapy. Moreover, it tends to be more focused on a particular phase of disease, that is advanced cancer. However, I knew that I wanted to bound or limit the case even further. Otherwise, there may be some concern about would the cases be too broad. For example, if I've just focused on oncology treatment choices, would that mean that my cases would be focused on oncologists or nurses or even pharmaceutical companies? So after some thought, I knew I wanted to collect cases on the choices of patients. So the final focus of the cases was the choices of advanced cancer patients around their oncological treatment. So this research focus, I felt, was very bound. So for instance, it helped me focus my own analysis. We may want to know a little bit about the comorbidity of the study participants, and we might want to know a little bit about their early diagnosis. But the main focus of the cases were the choices that people with advanced cancer made around their oncological treatment. So before researchers begin to collect data or information about a case, they have to think critically about what should be included. Moreover, they'll have to think about what is a starting point to build the case. So remember in the introduction, I spoke about how case study can promote an in-depth examination of a topic. So one of the distinctive features of case study that I use in my research is that it includes many forms of diverse research data. So for example, a case might include interviews with different people. It might include documents like policies and blogs. It might also include researchers' observations of different events. And cases may vary in their composition. That means that if you're collecting multiple cases within a project, each case might be different. For instance, one case might involve lots of observational data. Another case might not have any observational data because it's not as relevant to understanding that case. So when collecting case data, case study researchers in general compose cases to create a really rich picture of the research topic and also to get a sense of the context that informed the case. So this is a sample of what a case might look like from my research. So as I said, it's an example of the work that I've done. So in this case, the patient is seeking additional oncological treatment, and they're at the center of the case. And I build the case around this particular person to understand why this patient seeks these kinds of treatments, and also how do patients make this decision. So part of this case includes an interview with a family physician. It also includes an interview with a family member. In addition, this case includes observations of appointments between patients and physicians to understand how they communicate with each other, and what types of information they exchange during those meetings. Also during interviews, I ask patients to name any magazine articles, websites, books, and social media that they use to make treatment choices. So I also included in this case a blog about cancer treatment as part of the case. So just a reminder that each case in a research project might look different and it might have different composition depending on the case and what it's about. So the final point of this video I wanted to make was to highlight how case study research can encourage multiple perspectives about a particular event or issue. So case study researchers like myself often consider different types of research data collected within a case, which can provide very valuable information and may be part of the final study results. So the different perspectives about a topic may be similar, they may be different, they may be contradictory. But I might want to consider why are they different and why are they similar. So examining different points of view provides very valuable information about the social world and what are some of the contexts that surround the case. So these contexts might be political, social, relational, or economic. When analyzing the data collected in a project, researchers like myself might compare different cases, but also might look within a case. So in this example, I wanted to highlight how having different points of view or different perspectives might be used by researchers to tell us something new or innovative about a topic. So for example, during this interview with a patient, this person said, "My oncologist never listens to what I want." However, during an interview with a physician, the same oncologist the patient was referring to says, "I always listen to what my patients want. I am receptive to their suggestions when appropriate." So as a researcher, I might want to consider why are their perspectives different? Is it related to the physician role versus the patient role? Is it related to different expectations, access to knowledge, or perhaps different power relationships? So if we look at the data even more, and we consider data within the case, we might examine suggestions from a blog that the patient is reading. So the blog might state, to the patient, you should be in control of your medical appointment and demand to be heard. So how does this impact the patient and how the physician relates to one another? So you can see in this really short example the potential of case study research to be very dynamic and exciting. So thank you for taking on this interesting journey with me about qualitative case study research. Although it's a traditional form of qualitative research, it's a really exciting way to conduct research in the health sciences. So I want to conclude by drawing together some key points. So read case study research if you need information, in-depth information, and contextual information, want answers to how and why questions, seek information about a topic beyond the cases that you are studying. If you're a novice or clinical researcher, you might want to conduct case study research if you want to study a bound topic, if you think it's helpful to collect different types of information, data like interviews, observations, documents, or if you're interested in collecting the different vantage points or perspectives about a narrow topic. If you're interested in reading more about this topic, I would encourage you or recommend the reading by Baxter and Jack. It provides a really good overview of the fundamental principles of case study research, and it's a really good place to start. If you're interested in actually conducting case study research, I would really recommend the book Case Study Research by Yin. It's more of a technical or detailed read, but it's by far the most quoted research book about case study, and it's essential, I feel, to take a look at. So once again, I'm Dr. Shah Mohammed, and thank you for listening.